Hi and welcome to Optimum TV. Today I'm joined by Dr. Agnès Arbat, co-founder and CEO of Oxolife, a Spanish biotech which is focused on female fertility. Oxolife has just presented some fantastic results on its lead product, OXO001, a pill to increase the chance of an embryo implanting following IVF and ICSI. Hi Agnès.
Hi Stephen, thank you very much. Pleasure to be here with you today.
So, Agnès, IVF and ICSI is very common these days, but very often it doesn't succeed. It doesn't result in a baby. Tell me the main reasons for that.
Yes, 76 million women have a diagnosis of infertility each year. And despite all treatments and all technologies that we have today, still more than 65% of the embryo transfers that are performed yearly fail due to implantation failure. It is actually the big unmet medical need.
And tell me, Agnès, how your lead product, OXO001, which is a pill, tell me how it's taken, how long it's taken for, when it's taken, and very simply the mechanism of action.
Yes, OXO1, it's a pill. It's a non-hormonal pill that is taken daily. From 10 to 12 weeks, it started one menstrual cycle before the embryo transfer, the menstrual cycle of embryo transfer, and 5 weeks after the embryo transfer. And the compound acts directly on the endometrium by enhancing the expression of key molecules that enable the embryo to adhere, invade, and complete implantation.
Fantastic. So let's talk about the data and the trial itself. This was a randomized, placebo-controlled, double-blinded trial, as I understand it, testing your lead product against a dummy pill.
Yeah, that's right. It was a big step for Oxolife. The phase 2 was performed in Europe. It involved more than 300 patients. The countries that participate were Spain, Czech Republic, and Poland, with 28 sites. So a lot of investigators from Europe already participated in the trial. And regarding the patients, there were patients that were from 18 to 45 years old, and in an egg donation program with a normal ultrasound, gynecological ultrasound, so they were ready now to perform an embryo transfer. And yeah, the embryo needed to be at a minimum quality, right? At least 3 BB and day 5 of blasto, and a minimal thickness of the endometrium of 7 millimeters.
Okay, and you were including women who were using donor eggs because there's less variability in the quality than those using their own eggs. Is that right?
Yeah, so this was a methodological decision, right? As I explained, the drug acts on the endometrium, and it was very important that we isolate the effect of the compound on the endometrium, and this was the best measure to do that was trying to have the best embryo quality, no? And for that. We choose patients in an egg donation program, so the oocytes were younger, let's say, and with better properties than from autologous oocytes. So we choose patients in an egg donation program, but also with good quality embryos, so we could really see the effect of the compound on the endometrium.
Okay, understood. And let's talk about the results. And the results, for clarity, were in women who were under 40.
Yeah, we see positive effects in the overall population, but the most amazing results are in the population up to 40 years old, which is the biggest population today that are going through IVF procedures. And what we see is an increase in all parameters, all the efficacy outcomes of parameters which are important on the pregnancy journey. So we see a more than a 20% increase in the biochemical pregnancy rate, which is the first sign of pregnancy. And these were statistically significant. And we also see a very relevant clinical increase in the clinical pregnancy rate, the ongoing pregnancy rate, and live birth rate. The increase in live birth rate was an absolute increase in plus almost 7%. So we see 7% more babies in the arm treated with 300 milligram dose, which is the highest dose that we tested in the trial.
And the live birth rate increased from something like 36% in placebo, no, 37% in placebo to, I think it was 43% or so, those kind of figures, wasn't it?
Yeah, that's right. And for us, it's also very important that this was a single intervention, meaning that all patients were just under one embryo transfer with one single embryo transfer, right? So an increase of this 6.9% in live birth rates with just one single intervention, it's a really big step.
I mean, an increase of 5 percentage points in the live birth rate is considered a very notable finding, isn't it? A big increase.
Yes, yes, totally. Before, when we planned the trial, we were thinking about an increase in live birth rates from 3 to 5%, because we know not from the scientific societies and also the key opinion leaders and also hearing a patient's voice that an increase in 3% in live birth rates would mean a lot, and they would be really looking forward to use the compound in order to enhance the chances of having a baby. So going to this up 7% increase, it's really an important step for us. For the
and
science.
Oxolife won a prize at ESHRE for this presentation. Tell me about that.
Yes, we presented the result last Monday at ESHRE Congress in Amsterdam. It was first time, so very happy to have the chance to communicate our results. And thanks to that, we were honored. We are honored, and we received the special prize, for the best scientific communication in the Congress from ESHRE Society in collaboration with the Australian and New Zealand Reproductive Society. We are very happy about this. It's a recognition of the work that we've been doing for 10 years, and endorses our work and the results of the trial.
Next steps, you've got a phase 3 trial planned, but not in women using donor eggs, in women using their own eggs, which is important because they account for the majority of women undergoing IVF and ICSI, don't they?
Yeah, right. So with the phase 2, we have been able to demonstrate the effect of the compound in the endometrium, with the design that we planned. But now that we have demonstrated that, we will go in a phase 3 with patients with their own eggs. Still, we will be asking for good quality embryos, but the idea is to go with a big phase 3 in Europe with 1,600 patients with their own eggs.
Super. And throwing things forward a bit, there will be women who perhaps have not resorted to IVF and ICSI fertility treatment so far, but are having trouble conceiving. Is it possible at some point in the future that your lead candidate, OXO001, could be used by women in that situation?
Yes. Our first step now is enhancing the success in infertility patients. But we've seen in the phase 1 clinical trials that we are able to enhance this fertility in patients, in volunteers, in healthy volunteers, through this mechanism of action. And we have also seen this effect in the preclinical studies. So our first step is going to infertile patients, but in the life cycle management, in the product once in the market, our next steps will be for patients that are for women that are trying to conceive, that want to have a baby, and to enhance and let's say faster achieve pregnancy and baby.
Super. Well, congratulations on your results. I'm sure we'll be hearing a lot more from Oxolife in the future. Dr. Agnès Arbat, thanks for talking to me.
Thank you very much. It has been a pleasure.
For more Optimum TV episodes, please visit our website, optimumcomms.com, or our YouTube channel at Optimum Comms. Thanks for watching.